Bertemu kembali dalam Niaga AWANI. Kalau kita melihat pandemik COVID-19 ini banyak membawa perubahan dari segi sudut digitalisasi dan juga teknologi di kalangan semua sekali sektor ekonomi. Tidak ketinggalan sektor kesihatan yang amat tertekan ketika pandemik COVID-19. Sudah pasti kita melihat bagaimanakah digitalisasi ini membawa sektor kesihatan kita, mengurangkan beban mereka, dan sekarang kita bercakap soal bagaimanakah digitalisasi dalam sektor penjagaan kesihatan yang sebelum ini agak bergerak perlahan, namun akibat COVID-19 ia dipantaskan lagi dan juga accelerated berdasarkan kepada teknologi sedia ada dan juga lebih banyak lagi cetusan-cetusan idea dan sebagainya. Itu yang saya bincangkan pada jam ini. Saya nak bersama dengan Dr. Chan Hai Feng, iaitu pengasas dan juga ketua pegawai eksekutif Clear. Good morning, Dr. Chan. I hope I pronounce it correct, Clear. Thank you so much for being with us. First of all, share with us about these apps and how does it reduce the burden of our healthcare system?
Hi, Najib. Good morning. First of all, thank you very much for inviting me to this interview. So yes, about Clear. First of all, we would like to introduce what is Clear. So Clear is actually a digital platform, which is a medical point of care test platform that connect the users and the doctors virtually. So this platform, it actually allowed the users to perform their COVID screening at home and and submit to the doctor for verification. Why is it we come about with this idea? Is that over the past, COVID had been approaching the end of the second year now, and over this period of time, we had been actively involved in COVID screening. We had been actively involved in treating COVID patients. And we find that there are a lot of room of improvement in terms of improving the cost, the time for the doctors, and of course, the risk of exposure of COVID towards all the healthcare workers. There was once that we have a whole team who are screening COVID that had infected with COVID, and they are positive for a duration of 1 month. And during that time, we have a constraint of human resource because of this. Hence, we come with this idea that we can actually, why not we innovate, we come up with something that can actually help in reducing this, and hence Clear. So with this Clear, we actually allow this user to run the whole COVID screening, and the doctors can actually verify the whole process, including an ID verification of the user's identity, cassette verification of the test kit, and also a full video recording verification by the doctors. So the doctors can actually see, hey, if these patients are doing the correct way, is the patient doing everything within the frame that can allow the user, the doctors to decide to approve or not to approve the COVID screening. So with this, it actually saved a lot of the doctor's time, and it also saved the risk. It also reduced the risk of exposure of this healthcare worker towards these COVID positive users. Yeah, so it's very exciting that we actually had introduced this to the public already, and we are we are actually receiving quite an overwhelming response from the Malaysian, especially the Malaysian public. And we have successfully served some of these rural area patients that required a COVID screening. So we are quite happy that it actually worked for them.
It's actually quite bridging the gap between the rural and urban area where, the healthcare provide the healthcare services, as we know in the urban area is provided more, well established in that sense. But more and more thing that we can learn from COVID-19 is that digital healthcare is the way forward, basically. How do you foresee the industry will be in the next 5 years? Maybe some of the trends as well.
Yes, for example, for the next 5 years, this telemedicine, we think that actually telemedicine is the future of medicine, but we think that it cannot replace a doctor role in the treatment to the patients. However, it can really complement the medical industry in many ways. But we see bottlenecks in this industry where we need more discussion with, we see the bottlenecks in policies, in regulations, in devices, in innovations, in talents. So we actually need more discussion between all the parties and come up with a comprehensive plan that can actually curate the correct product to the users in the market.
And Dr. Chan, technology should make things seamless and to help businesses or in this case healthcare system to manage their cost better, especially for private hospitals and clinics. How can digitalization of healthcare system help in terms of cost?
All right. So that is all about digitalize everything, right?
Yeah.
To save costs, to save human errors, right? So for example, I would like to take Clear as an example. Um, so when we are doing COVID screening with the traditional way, it actually take up to probably 5 minutes for patients to come to our clinic and run the full screening and get the results. So the doctors have to spend time wearing their PPEs, consulting the patients, giving advices, and perform the screening physically. Um, so it actually take a lot of time, and it probably is a waste of time if the patients are not coming in one go, and we are spending so many of our time to just screen a few patients. Is definitely not efficient. So with this platform, with this Clear platform, we actually able to reduce the time of screening one patient to only 30 seconds, meaning that the doctors can actually verify the whole process without the risk of exposure to COVID positive patients within 30 seconds. And everything is almost the same like what we are physically doing in a clinic. So of course, with the time saving, it brings the cost saving. We know that doctor's professional fee worth something, and we have to pay for the doctor professional fee. And with that time saving, of course, the whole cost will be bring down. So we think that this don't only apply in COVID setting. It actually apply in many other settings as well. Other medical related consultation settings where you can actually bring the whole thing down, the physical location, and of course the most important thing is still the doctor's time. They've emphasizing a lot on that.
Okay. We have another 2 minutes, Dr. Chan. If you can share with us your future plan for Clear itself, because right now you are focusing on the COVID-19, but what's the plan for the future?
All right. So great. So the future plan of Clear is the most valuable thing in our companies. And currently, we are actually very, very busy fighting COVID. We are utilizing all of our time and effort to fight COVID. And we want to win this war. We want to win this war for our country. And for this, at this moment of time, we are looking at introducing clear platform to more people, more users, or more countries that actually need it to fight against COVID. For us, we are a group of strong believer doctors that we think that vaccination is not the silver bullet for COVID. If we are just depending on one weapon to fight COVID, is rather dangerous. Hence, we think that a mass screening or a frequent screening can actually reduce the risk of transmission, reduce the risk of infection between people, between crowded spaces. And this can actually help all of us to win this war. And once we win this war, then Clear will introduce our next features to everyone.
Okay, alright, Dr. Chan Hai Feng, pengasas dan juga Ketua Pegawai Eksekutif of Clear. Thank you so much for joining us with us, for spending time with us this morning. Itu bagaimana untuk kita melihat ini teknologi memudahkan urusan kita dalam aspek penjagaan kesihatan dan sudah pasti ini terus menjadi tumpuan. Kita akan melihat sekali lagi, kita akan kembali selepas ini dengan perkembangan antarabangsa.